One major misconception about cholesterol that needs to go.
That if you're thin, that your cholesterol is going to be fine.
Right.
I think, put it the other way, that only
Obese.
people who are obese have high cholesterol levels. That is completely a fallacy.
Good one. Next one is LDL versus HDL. If you could give them a one-word description, what it would be?
So LDL is bad cholesterol because it accumulates in the walls of the artery, causing heart attacks, strokes, etc. HDL is good cholesterol. So HDL good, LDL bad. We want LDL levels to be low and HDL levels to be high.
The most underrated habit for a heart-healthy life.
Screening. I think not checking our parameters. Let's say, for example, given what we've been discussing, the lipid profile.
At what age should someone start getting their lipid profile checked?
As soon as possible. I'm not saying as whilst being a baby, but once they should have their, even if they're in their early adulthood, they should have it checked.
One food people think is bad for cholesterol, but it isn't.
I think, for those who are non-vegetarians, eggs, for example, a large egg has not a lot of saturated fat.
Yes, right.
But it also has some, good sort of effects on health. So, one large egg a day is probably has 1.5 grams of saturated fat, I think, roughly. So that should be fine, for those who eat eggs.
Correct. What is worse, high LDL or low HDL?
Any day it's high LDL because LDL is bad cholesterol and that's the one we want to be low rather than.
One red flag in routine checkups that people tend to ignore.
I would say high cholesterol levels.
Okay.
So, absolutely, important to further investigate that, especially when it's not just the total cholesterol level, but all the different individual components that need to be seen.
So statins or lifestyle changes, which comes first?
Lifestyle changes definitely. Statins, I would say, need to be considered very seriously, depending again on the risk profile of the patient.
The biggest mistake people make when trying to lower cholesterol.
I think adherence to drug therapy if prescribed.
Right.
I think because it's, like you say, a silent killer,
Yes.
It has got no effects, no signs or symptoms. It has got effects, I apologize, but doesn't have signs or symptoms. So they think that, dawai kha ke hoga kya,
Right.
But the whole point is to prevent that event.
So if you could give one piece of advice for better heart health, what would it be?
Get your lipid profile cholesterol checked.